Welcome everyone back to another episode of the Parkinson's Policy Podcast, where we advocate together to raise awareness and advance meaningful policy for the Parkinson's community. From Washington, D.C. at the Capitol and beyond, we bring together senators, representatives, researchers, advocates. Today, truly an honor to have a NIH representative, someone who's dedicated their life towards this passion he has, and to amplify the voices of people living with Parkinson's disease and their families. My name is Dr. George Ackerman, Sharon's son and the founder of TogetherForSharon, joined by my co-host, Margaret, Preston, president of Power Over Parkinson's, and I wanted to welcome you all.
Well, I have the privilege to introduce our next guest on the Parkinson's Policy Podcast. Dr. Koroshetz serves as director of the National Institute of Neurological Disorders and Stroke. He joined the NIHand in 2007 as deputy director and has held leadership roles in multiple programs, including co-leading the NIH's Brain Initiative, the NIH Recover Initiative on post-acute sequelae of COVID-19, pain research and the Helping to End Addiction Long-Term or HEAL initiative, the Accelerated Medicine Partnerships for Parkinson's, and the Public-Private Partnerships in ALS. Before joining NIHand, Dr. Koroshetz served as Vice Chair of Neurology and Director of Stroke and Neurointensive Care Services at Mass General, neurologist at Mass General Brigham, and in the MGH Huntington Disease Clinic. He was a professor of neurology at Harvard Medical School and led neurology resident training at MGH between 1990 and 2007. Dr. Koroshetz, thank you so much for being with us in the Parkinson's Policy Podcast.
Oh, it's a pleasure, Margaret, and a pleasure, George, to talk to you today. Absolutely.
Well, again, it's truly an honor. We've followed your work. We followed the things and the really life-changing for the better policies that you've worked on. So I'd like to start the show by talking a little bit about awareness. Parkinson's disease, unfortunately, is the fastest growing neurological condition in the world. From the NIH perspective, though, maybe you could touch on why increasing awareness so critical today in our society. How does awareness directly impact research, diagnosis, and patient outcomes?
Well, I think a couple of things to say about that, George. First of all, the effort to deliver better care for patients and the efforts to develop better treatments for patients, some of those things are going to happen, but to have strong advocacy pushing for it is, I think, makes it happen a lot faster, and you get better results that way. So I think the more people know about Parkinson's, and the stronger they can advocate for better care and the development of better treatments, the better the health of America is going to be, as well as the health of people who are at risk or actually have Parkinson's. So I think that's certainly one way of thinking about it. I think, concretely, in the government, the government is responsive to the citizens, and the citizens with Parkinson's and the organizations with Parkinson's, really got this bill that was passed by President Biden to put a national plan to end Parkinson's Act. So if it wasn't for awareness and advocacy, there would be no national plan to end Parkinson's Act. So that's a real concrete example of the results that come out of awareness and advocacy.
Very well said. I wanted to continue to elaborate on the spike in diagnosis rate of Parkinson's disease. Of course, George's mom had Parkinson's. My father was diagnosed with Parkinson's disease 7 years ago. So if we want to expand and kind of think about what the NIH and their thoughts around this kind of alarming spike in Parkinson's disease, what is the NIH really attributing to this spike and increase in diagnosis rates?
Well, I think the answer is we don't know. And yeah, it's increasing, and there has to be a reason for it. It's definitely not genetics. The genetics is going to cause a certain percent. So there must be something else. And so I call that the dark matter. These are things in the environment that influence us in terms of developing different neurologic diseases. So Parkinson's, ALS, Alzheimer's, very similarly, there are certain genes that will cause the disease or increase your incidence, but it only accounts for like 20% of the disease. So there are other things that are out there that we don't know, we can't put our finger on. Now, I think there are a couple of clues, and we don't know if they're going to turn out, but I think the thing that's most striking now is that there's pretty good evidence that the biological problem of Parkinson's, which is what we call a synucleinopathy, where that protein synuclein aggregates in cells, that might start out 20 years before anybody has any symptoms, and it might start out in the nerves that supply the gut. So if you think about it, your gut is a lot of chemicals are in there. There's lots of bacteria. It's not impossible that there's something there that causes synuclein to aggregate in some of the nerves that are right there against the gut. And we do know that once the synuclein aggregates, it can travel into the brain, over years. So that's possible that there's something at the interface between the environment and the nerves. We're not thinking about the brain even right now. We're talking about the nerves that go out to the gut, or the nerves that go out to the nose. That's another place where people are looking, where this problem might start and then move into the nervous system. And if we can nail that down, we might be able to prevent it from happening.
Yeah.
In regards, you mentioned earlier, something we both actually worked hard to help pass, or at least from our respective states, the National Plan to End Parkinson's. I recall literally almost crying when I found out it was passed, because although my mother couldn't see it, I was so happy for all those out there who are still battling and need the support. So I want to thank you for all the incredible work you've done on that. But in regards to the plan, it is a major milestone for the entire, country, specifically Parkinson's community. Can you explain what the aim is now to accomplish it? How will it change the landscape of Parkinson's research, care, and collaboration?
Right. Well, yeah. So I think it's really important, George. We've been working here for like a year and a half to try and get this to actually happen. And good news is I think the letters just went out today. So it's very timely that the council members are going to be appointed. And the idea behind this is to develop a group of people who will then work to put out on paper a plan that could lead or is aimed at ending Parkinson's disease. So, for instance, there may be components of it where you're looking at the environment, trying to find out, is there something in the microbiome or in the air that gets into your nose that starts the synuclein seeding going. There will also be groups that will be looking at how do you provide better care for people with Parkinson's disease. So there's care and services, and then there's the research side of things. And the committee is composed of people who come from Parkinson's advocacy organizations, people who have Parkinson's disease, scientists who work on Parkinson's, doctors and social workers who take care of Parkinson's. That's going to be a very eclectic but very broad group, and they'll be working to put a plan together, and they're being asked, you put the plan together, this is what needs to be done. Not only that, but to actually put down how much it would cost to do that, and that plan then gets sent to Congress, and then you see what happens after that. But it will also inform, I think, the entire research community and the care community for Parkinson's on a real scholarly, thoughtful look at what's needed. And that might inform a lot of aspects of what's going on in Parkinson's now.
I want to expand on the national plan. We know, of course, research not only affects change, but also provides those living with disease a lot of hope as they participate in it and hopefully see positive results from research. So I wanted to ask about some of the most promising areas in Parkinson's research that are currently being supported by the NIH, and how does the national plan really help accelerate research in therapeutics, treatments, and ultimately the cure?
Okay. Well, I would say that I think the thing that is probably the thing that's changing the most is the ability to diagnose the synucleinopathy. So, as you all know, as we've mentioned, Parkinson's disease, the diagnosis was a clinical diagnosis. So I was a physician, I took care of people with Parkinson's, and you're looking for certain signs and symptoms, And in the early stages, I think docs were about 80% right and 20% wrong. And those were the kind of the best, specialists. So, and then we didn't really know in that time what the actual cause of the disease is. We didn't know about the synucleinopathy. But now I think there's a really good test to diagnose synucleinopathy, and it's a test. It's called the seeding assay, and it can be done on spinal fluid, but it can also be done on skin. Probably not as accurate as the spinal fluid exam, but you can see these synuclein aggregates in the spinal fluid with the seeding assay, and you can also see it in the skin on skin biopsies. It's in the nerves that go to the skin, particularly the ones that go to the sweat glands. So now people can be diagnosed. Now the really scary thing about this is it's almost like a genetic test, because it becomes positive years before you have any symptoms.
But
so what I suspect will happen next is that this test will be made better and better and better and easier and easier and easier. And then you'll be able to screen people and be able to find out who's going to get Parkinson's, which is fantastic for research because you can start to intervene early before you get symptoms. If you do that and it works, then you cure the disease because it never causes any symptoms.
Yeah.
The downside is if you don't have anything that works, you're going to have 1 million people who know they're going to get Parkinson's, then there's no treatment. And that's going to be very, very anxiety provoking. Yeah.
Thank you.
I was wondering if you could explain to our listeners something else that's very important is individual state registries can help also assist federal understanding of the disease. I don't know if, I think Florida might have just passed it. I know Virginia always seems to be at the forefront. But I was wondering for assisting federal understanding of the disease, diagnostic rates, and can ultimately help shape a better understanding of its complexity. So it's kind of a two-part question, how can everyone out there also help all the work that you all do? This is very important because it's not just about us alone. We need everybody together in this.
Well, I think, the registries can be very valuable, particularly as we talked about right in the beginning in terms of the dark matter. So the question is, if it's pretty clear there has to be something in the environment that's starting this disease off. We don't know exactly what it is. We have some clues. But the value of registry is you can actually see pockets where you see more Parkinson's than you should, and that might lead to investigations on what is there in that environment that increase the risk of Parkinson's in that group. So that's what I would see as really valuable in terms of getting to understand the environmental thing. So as you may or may not know, but years ago, Carolyn Tanner in California looked at the incidence of Parkinson's in different areas of California and associated them with the pesticide use in those regions, and pretty clearly showed there's clearly a role of pesticides in increasing the risk of Parkinson's. So registries like that in other parts of the country would be very valuable.
I'd like to close as we talk about, of course, the national plan and ultimately kind of invigorating the community to get involved. For individuals living with Parkinson's disease, their caregivers and advocates around them, how can they really get involved in supporting the national plan, and what message of hope would you give them to the Parkinson's community?
Yeah, so a good question. So the bad news is that I didn't get reappointed, so I'm going to be leaving. So I can't really help too much, except I might be able to help on the outside. We'll see. But I think that what I suspect that will happen is that the group that gets together will then develop what we call workshops, where they get input from wide broad groups, and that will include people with Parkinson's, and that can be very powerful. I can tell you, we did this about 2 years ago with multiple sclerosis. The National Academy of Medicine ran the workshops, and we had testimony from people with ALS, and it's very powerful. and it should definitely lead to change, particularly on the care side. And then I think also the the issue of developing the national plan and developing a budget for that. That's fantastic, but it's only going to be if there's a lot of interest on the part of the citizen in the U.S. that would turn into actual funding. So I think it's really important for the Parkinson's community to stay very abreast of the national plan and give input. If they go off the wrong way, you got to tell them. And I think they're good people; they'll listen. But also, the plan is not what the plan is. A plan. That's good to have a plan, but you really want to get the plan executed, and that's the second stage. And that's what is still, we don't know what that's going to look like. But certainly, the community has to stay engaged for any kind of implementation to happen.
Yes.
You laid the groundwork. You did a lot of the hard work, and now it might be moving forward. But I believe it was because of your inspiring work, and we're so grateful for your time today, and also all the work you will continue to do. I hope we can all keep in touch. Just wanted to ask Margaret to say any last comments, and then we'll wrap up.
Yeah, well, Dr. Koroshetz, we can't thank you enough for your time. As you learned, both George and I had and have a parent with Parkinson's disease. So you're spending your life's work, kind of figuring this out, trying to crack the nut and its complexities. We can't thank you enough. Personally, thank you. It takes dedicated folks as yourself and advocates surrounding you to move the needle. So we appreciate it.
I have family members with Parkinson's too.
So there you go.
All in the same boat. Yeah. We're all trying.
We appreciate you spending, like I said, your life's work doing this. So thank you for being with us today.
All right, Margaret, George, thank you. It's a pleasure.
Thank you, everyone. This has been another episode of the Parkinson's Policy Podcast, where we advocate together to raise awareness and advance meaningful policy for the Parkinson's community. Please stay tuned. A lot more shows to come because we still have work to be done, and we'll be advocating right by your side. Thank you all.
Thank you.
All right.